Good afternoon, everyone. The first item of business this afternoon is portfolio questions, and as ever, in order to get as many people in as possible, I prefer short and succinct questions and answers to match, please. Question number 1, Bob Doris.
Thank you, Presiding Officer. To ask the Scottish Government what recent discussions it has had with NHS Greater Glasgow and Clyde.
Cabinet Secretary Alex Neil.
Deputy Presiding Officer, Ministers and Government officials regularly meet with representatives of NHS Greater Glasgow and Clyde to discuss matters of importance to local people.
Thank you. Bob Doris.
I thank the Cabinet Secretary for that answer. The Cabinet Secretary will be aware of my personal interest on access to new medicines, in particular access to medicines for orphan and ultra-orphan conditions. I have a constituent who I won't name in this chamber for their own personal confidentiality circumstances, but they are suffering from Pompe disease. They have previously been refused an individual patient treatment request, and they are indeed a patient of Greater Glasgow and Clyde. I am worried that Greater Glasgow and Clyde may not be showing the flexibility that the Cabinet Secretary has called for in relation to the individual patient treatment request system ahead of the welcome reforms that the Scottish Government are implementing, and I wonder if the Cabinet Secretary could use his good office to make sure they start to use that flexibility more consistently to benefit everyone, but particularly, of course, the individual constituent whose details I can provide you with information with after these questions.
Cabinet Secretary.
Presiding Officer, the Scottish Government has made clear in its expectation that boards are more flexible in their approach to considering individual treatment requests for not recommended medicines. However, consultants and Scottish health boards make decisions on the appropriate treatment for their patients. The IPTR decision in relation to Misozyme for the patient in question was made by NHS Greater Glasgow and Clyde. And can I encourage Bob Doris to send me the details and just say that I have been in touch with Greater Glasgow and Clyde Health Board resulting from the evidence given to the Beatson consultants on this issue, and emphasise the degree of flexibility that health boards now have in respect of such applications.
Thank you. Jackson Carlaw.
The Cabinet Secretary will be aware of the speculation there has been about conversations he may have been having with NHS Greater Glasgow and Clyde over the Government's response to their consultation on chronic pain and the possible use of the Glasgow Homeopathic Hospital as a permanent centre for the management of chronic pain. In his usual typical way, I wonder if the Cabinet Secretary would be gracious enough to share with the Chamber his current thinking in these matters.
Cabinet Secretary.
Presiding Officer, the Ministers are considering the responses to the consultation on chronic pain, and we will be making an announcement fairly soon in respect of our response to the responses.
Thank you. Question number 2, Roderick Campbell.
Scottish Government what steps it is taking to ensure that NHS boards have an appropriate policy to ensure the safe disposal of used needles.
Cabinet Secretary Alex Neil.
Presiding Officer, the Scottish Government published national guidelines for services providing injecting equipment in 2010. Recommendation 16 of that guideline specifically states that NHS boards should ensure that all services in their area have robust policies and procedures in place in relation to the safe disposal of used injecting equipment.
Roderick Campbell.
I thank the Cabinet Secretary for that answer. The current position in Fife is mixed. Some health centres and pharmacies accept sharp, some do not. There's a particular problem since landfill sites have stopped accepting specially made containers because of risks to operators. Can the Cabinet Secretary advise what further support the Scottish Government can offer to health boards to ensure that they make an appropriate policy?
Cabinet Secretary.
Presiding Officer, the Health and Safety Sharp Instruments and Healthcare Regulations 2013 require all employers, including obviously health boards, to have policies in place to ensure the safe disposal of sharps. The Scottish Government wrote to all NHS Scotland boards on the 2nd of May 2013 advising of the introduction of the regulations that came into force on the 11th of May 2013, and if there is any evidence of these regulations not being adhered to, then if Roddy Campbell or anyone else submits it to the relevant authority, we'll certainly investigate the matter.
Many thanks. Question number 3 has been withdrawn and an explanation has been provided. I therefore call question number 4, John Lamont.
Thank you, Deputy Presiding Officer. To ask the Scottish Government how many bed days were lost due to delayed discharges in the NHS Borders area during the last 3 quarters of 2013.
Cabinet Secretary Alex Neil.
Presiding Officer, there were 5,826 bed days lost to delayed discharge in NHS borders between April and December 2013, a 6.5% reduction from 2012.
John Lamont.
I thank the Cabinet Secretary for that answer. This issue causes huge problems not only for hospitals but also for patients who are fit enough to leave hospital but are forced to wait before being discharged and allowed home. These figures show that the problem is far from being solved, and there can be no doubt that something needs to be done to address it. So what plan does the Scottish Government have to help reduce the problem further, to help reduce the delayed discharges in the borders and for the rest of Scotland?
Cabinet Secretary.
Presiding Officer, perhaps the member should have waited to write his press release after I give him the answer. Can I say there were a total of 8 patients delayed for any duration at the January census in Borders, with none delayed for more than 4 weeks. And the Borders area is one of the top 3 best performing boards in the whole of Scotland in terms of delayed discharges. I'm sorry to ruin his press release, but these are the facts of the situation.
Neil Findlay.
Delayed discharges, of course, are a problem across the country, with 15% of care homes places unavailable in Edinburgh and 15% in Highland, 20% in Glasgow, all unavailable due to concerns about the level of care being provided. Can I ask the Cabinet Secretary what's being done to address these really serious concerns across Scotland and also in the borders?
Cabinet Secretary.
Deputy Presiding Officer, there's a total at the last count of 57 homes where there is some kind of moratorium imposed by the Care Inspectorate because of quality issues and concerns, and that has taken nearly 800 beds out of the care home system and capacity in Scotland. We are working, and the Care Inspectorate are working with the individual homes to see where quality can be improved. Some of them will be and are the subject of a closure order, but most of them are homes where the Care Inspectorate are working with them to get the situation into better shape in terms of the quality of provision. More generally, we have been reviewing the situation with our friends in COSLA, and we hope to report fairly soon on the outcome of our discussions and our look at the future in terms of care home and the quality of care home provision in Scotland.
Thank you. Question number 5, Claudia Beamish.
Thank you, Presiding Officer. To ask the Scottish Government what its position is on complementary medicines and therapies and on supporting NHS boards in their use.
Cabinet Secretary Alec Neil.
Presiding Officer, the Scottish Government recognises that complementary and alternative medicines, CAM, and therapies may offer relief to some people living with a wide variety of long-term conditions. Current Scottish Government policy is outlined in HDL 2005-37, which was published in 2005. This guidance sets out the framework for the provision of CAM. It is for individual NHS boards to decide what complementary and alternative medicines they may make available based on the needs of their resident populations in line with the national guidance.
Claudia Beamish.
I thank the Cabinet Secretary for that quite comprehensive answer, which is helpful. However, I have been approached by constituents in both NHS Lothian and Borders and in NHS Lanarkshire. And there is, as the Cabinet Secretary will no doubt know, a review of homeopathy at present in Lanarkshire. And although some express concerns about scientific evidence for complementary medicines, there are long traditions in many countries, and including here as well. In fact, far longer than some of the ones here. And the evidence is before our eyes. Reflexology for sports injuries, many support groups using complementary therapies, and I've just actually come from the CPG for Carers, which I convene along with Joan McAlpine, and heard about support for carers in a therapy of hand massage. So I wonder if the Cabinet Secretary can give us some stronger reassurance about the commitment of Scottish Government today to supporting people in this way.
Cabinet Secretary.
Presiding Officer, as I said, the Scottish Government views has been made very clear and consistent with the previous administration. It is obviously up to the individual health boards, as I said, to decide in their own area exactly what provision they are prepared to make in respect of these services. As the member will know, the medical community is somewhat divided on the issue of homeopathy, some taking a very positive point of view and others taking a very negative point of view. As a non-medic, of course, I will remain neutral on the question.
Question number 6, Adam Ingram.
Thank you, Presiding Officer. To ask the Scottish Government what guidance is given to health boards regarding the provision of adequate public transport to and from their facilities.
Minister Michael Matheson.
It's a matter for NHS Board to identify any issues and potential solutions in discussion with the local authorities and regional transport partnerships who have funds to support transport services to meet the assessed needs of the market within their own area.
Adam Ingram.
I thank the Minister for his answer, but can I ask if he is aware of the reduction in the bus service between Ayr and Crosshouse hospitals following the ending of a subsidy from NHS Ayrshire and Arden, which helped establish the route? This reduction has resulted in making journeys for patients and their families from the south of my constituency to Crosshouse somewhat challenging. And despite discussions between the Health Board and both SPT and Stagecoach, there seems little prospect of an increase in the service in the foreseeable future. As such, I would be grateful if the Minister would consider bringing or helping to bring the relevant parties together with a view to finding a viable solution and, if required, making funding available to ensure patients in the south of Ayrshire are not disadvantaged in terms of accessing the care they need.
Minister.
I'm aware that initial funding was provided by NHS Ayrshire and Arn and Strathclyde Partnership for the transport provision to be established on this particular route that the member made reference to. That was with the intention of that particular route becoming commercially viable. However, I do understand that due to its low usage, it was not commercially viable, and Stagecoach were unable to sustain the service at the level that they had initially planned. The provision that we have at the present time is where a service is not provided by the market, that the local transport authority, in this particular instance that would be SPT, has the powers and also the budget to fund where it feels necessary to support adequate services. I'm more than happy to meet with the member to discuss this matter. However, I'm sure you will appreciate that the funding provision for this matter would be an issue for the local transport authority, and in this case that would be SPT.
Supplementary from Rhoda Grant.
Thank you, Presiding Officer. I'd ask if the Minister could look into this more widely, because it's not just a problem in Adam Ingram's area, it's one that's prevalent in the Highlands and Islands certainly, and I've been involved with patient groups in Nairn where there is no regular bus service between the town centre and the GP practice, which is based at the hospital, so patients for both GPs and hospital appointments can't get back and forth. And this is a big issue for elderly people who may be not able to walk that distance. Could you maybe look at it again? Because I suspect that this is an area of concern throughout Scotland that maybe needs an overall look to try and get health boards to work with their transport partnerships to make sure that people have adequate transport to hospital.
Minister.
Well, we're always prepared to look at different ways in which we can improve these types of issues, and it's important that health boards are actively looking to forge appropriate partnerships with the right agencies in order to overcome specific problems within their own localities. In an instance within NHS Highland, they should be looking to work with the Transport Authority there and the local authority in order to identify what is the best solution to overcome the type of transport problems that individual patients may be experience. If the member wants to raise very specific examples with us that she feels that the board are not adequately engaging with these partners, we'd be more than happy to make sure that the Health Board pay close attention to these issues and do engage with the local transport authority in order to find a solution to the matter. Thank you.
Question number 7, Hugh Henry.
To ask the Scottish Government for which cancers waiting time targets are not being met.
Cabinet Secretary Alec Neil.
Presiding Officer, the 2 cancer access standards are an all-Scotland standard and apply to all cancer types combined. There is variation in the numbers and complexity of some cancer types, and there are some cases where good clinical practice means that patients cannot or should not be pushed through a pathway to achieve a target. The 31-day target has been achieved ever since its introduction, and for the most recent published data, the 31-day standard was exceeded at 98.1%. In the most recent published quarter, 94.5% of patients in Scotland were treated within the 62-day standard. A breakdown of performance by cancer type can be found in the quarterly ISD statistical publications.
Hugh Henry.
I'm disappointed, Presiding Officer, that the Cabinet Secretary has referred me back to the ISD publications to get the answer to the very specific question which I asked him. It would have been relatively simple to give us the list of the individual cancers for which the targets are not being met, and I do accept some of the other points he makes about the wider calculation. However, a simple point and simple question, Presiding Officer. For each of the individual cancers where targets are not being met, can I ask the Cabinet Secretary if he will guarantee that the target will be met by the end of December 2014?
Cabinet Secretary.
Presiding Officer, the member hasn't understood my answer. The target is for all cancers combined. There is not a separate target for each cancer type. And indeed, I can remind the member that these targets were set in 2001 by an administration in which he was a minister, and we have retained exactly the same targets as defined exactly the same way as the previous administration.
Question number 8, John Mason.
To ask the Scottish Government what its position is on the widening availability and increased marketing of e-cigarettes.
Minister Michael Matheson.
While electronic cigarettes may have the potential to help people quit tobacco, their long-term public health effects are not known. I remain concerned that the promotion of these devices could renormalise smoking behaviour, particularly amongst young people. I welcome the revised European Tobacco Products Directive, which sets out a number of measures for the regulation of electronic cigarettes. This includes subjecting non-medical electronic cigarettes to the same advertising restrictions as tobacco products. The Scottish Government is also committed to considering what additional measures may be required in Scotland to further protect public health, such as restricting age of sale of electronic cigarettes.
John Mason.
I thank the Minister for his answer, and he probably knows that today is in fact National No Smoking Day. I note what he says about the companies perhaps trying to renormalise smoking, and I wonder if he shares my concern that the tobacco industry now seems to own most of the e-cigarette manufacturers, and we should be very guarded about their intentions.
Minister.
I'm aware that the tobacco industry have invested very heavily in electronic cigarettes, and I'm sure all members will recognise that their business is to ensure that people keep buying their products, cigarettes in particular. As I've said before, I do think that properly regulated electronic cigarettes may have the potential to help to support people in quitting tobacco. However, I think we need to make sure that we take appropriate steps to ensure that these devices are not used to renormalise smoking behaviour or to promote addiction. And this is especially important amongst young people who are not smokers and therefore do not need devices to help them to quit smoking in itself. I think it's right that we should also stand against promotions, advertising and sponsorship deals that feed nicotine addiction, especially in the context of being attractive to young people. And these are the types of principles which will underpin any further work that we take forward in this area.
Richard Simpson.
Begin by thanking the Minister for his robust stance on this issue, because I think it is an extremely important one in which the field is moving very fast. However, it appears to me from the EU decisions that there are going to be two classifications of e-cigarettes, above and below a certain level of content. Those below a certain level of content may have additives which are of considerable concern and will not be subject to medical devices regulation, even if that's agreed to be introduced. Will he actually consider referring to the Food Standards Agency the question of the content and safety of the e-cigarettes that are not going to be covered by devices? And will he also undertake to look at the possibility of research into where these things are being sold and to whom they're being sold, so we can determine more easily whether this is helping people come off cigarettes, which is, of course, the stated intent of the manufacturers, or whether, in fact, it is encouraging young people particularly to take up smoking? Minister.
I think the member is quite right in highlighting that this is a very fast-moving agenda and one which we need to make sure that we are proactive in addressing as we go forward. He's correct in that the tobacco directive from Europe highlighted a number of different issues that have to be taken forward. It is somewhat superseded the MHRA's recommendation around having them classified as a medical device. But what it has set out is the maximum level of nicotine that they should contain, and a range of other measures around, such as being child tamper-proof, etc., all of which I think are very worthwhile measures that should be taken forward. We are going to consider what further measures we need to take place here in Scotland, because what I'm anxious not to do is to undermine the decades of good work that's been undertaken in Scotland in reducing tobacco use, for that to be unpicked by the tobacco industry using electronic cigarettes almost as a Trojan horse in order to achieve their objective, and to look at what measures we need to put in place to make sure there are adequate safeguards around the use of electronic cigarettes.
Briefly, please, Jackson Carlow.
Can I assure the Minister that if he progresses this in a responsible and measured way, he will have our support? Can I too concentrate on the device itself, most of which are manufactured in the Far East? I don't think there is the necessary public awareness of the fact that some of these devices have been said to melt, to contain formaldehyde, to contain antifreeze and other ingredients. Will the Minister ensure that the public is made aware that it's not just nicotine, the device itself is potentially a harbinger of other serious conditions?
Minister.
I agree with the points the members made, and part of the challenge is because they are unregulated at this present time. The intention was that they should be regulated as a medical device, and MHRA had made recommendations about taking that forward, which would be introduced in 2016. However, the Tobacco Products Directive has somewhat superseded that, in that they should not be regulated on that basis, that they can actually be used as a device in their own right, but that we should take forward a range of measures in order to make sure that we regulate these things adequately in doing so. So the approach we are taking is one which we believe is measured and responsible. It's not about trying to get on the back of individuals who are making use of electronic cigarettes to help to reduce their tobacco use, but it's to make sure that there are adequate safeguards in place around how they are used and where they can be used.
Thank you. Question number 9, Rob Gibson.
Thank you, Presiding Officer. To ask the Scottish Government what recent discussions the Cabinet Secretary for Health and Wellbeing has had with NHS boards regarding recruitment of consultants for remote and Northern and Island hospitals.
Cabinet Secretary Alec Neil.
Presiding Officer, the Scottish Government has regular discussions on a wide range of matters with all health boards, including Highland, and including the issue raised in the question.
Rob Gibson.
Thank you for that short answer. In NHS Highland, too high a proportion of mums-to-be feel that they should not have to be hospitalised in Inverness, 100 miles from their homes in the north of my constituency. Can the Cabinet Secretary help us maintain maternity consultants at Caithness General Hospital in Wick and find suitable generalists required to make remote and rural hospital services to work?
Alec Neil.
Presiding Officer, it was very sad to hear about the recent untimely death of a locum in Caithness providing maternity services who was covering for a consultant who retired in December 2013. I'm glad to see that NHS Highland is working hard to recruit a substantive consultant to Caithness General Hospital. Workforce planning and recruitment is properly a matter for NHS boards, but I can assure the member that the Scottish Government also gives sustainable services a high priority, and we will continue to work closely with boards across Scotland to ensure the right people are recruited in the right numbers, in the right place at the right time, and that includes in Caithness and indeed in other rural hospitals in the Highlands and elsewhere.
Rhoda Grant.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary, because this is not just an issue for the health service, it's indeed an issue for the whole public service, to maybe work with other public service departments to see if they can work together, providing career breaks and the like for partners of those who are being recruited, because sometimes that is a block to people taking up jobs where they have to move home because there is no career pathway apparent for their partner. If all the public service came together and guaranteed jobs for partners, I think it would make the whole thing a lot more attractive and retain people in the area.
Cabinet Secretary.
Presiding Officer, obviously that would require detailed consideration. Being able to give that kind of guarantee obviously would have a huge number of consequences and implications, not least for finance. But meantime, we are working with boards, particularly in remote areas, island communities and remote rural areas, to ensure that we can get vacancies filled as quickly as possible, particularly in essential services such as maternity and many other essential services, because we fundamentally believe that people living in rural, remote rural and island communities are entitled to the same quality of care as everybody else living in Scotland.
Thank you. Question number 10, Paul Martin.
Thank you, Presiding Officer. To ask the Scottish Government when it last met representatives of NHS Greater Glasgow and Clyde Board and what matters were discussed.
Cabinet Secretary Alec Neil.
Presiding Officer, ministers and government officials regularly meet with representatives of NHS Greater Glasgow and Clyde to discuss matters of importance to local people.
Paul Martin.
Presiding Officer, in recent discussions with dental practitioners, they still advise me there are concerns about the levels of dental decay among children within my own constituency and other surrounding constituencies. Does the Minister commend with me the good work of the Gladiators project, which is based within the Easter House area of my constituency, the good work that they do in being creative in the way in which they promote good oral health among young people? Unfortunately, this project has seen its funding cut by the Greater Glasgow Health Board. I wonder if you agree to meet with me to discuss this matter further and look at ways in which we can ensure that this community project is supported in the good work that it's been doing since 1996.
Cabinet Secretary.
Presiding Officer, can I join with the member in underlining the importance of dental health care, not just in terms of dental care, but in terms of the impact it has on the rest of someone's individual health care. And I, of course, will be more than happy to meet with the member to discuss the local situation in his constituency.
Thank you. Question number 11, Christian Allard.
To ask the Scottish Government what discussions it has had with NHS Blood and Transplant about cross-border transplantations of organs in an independent Scotland.
Minister Michael Matheson.
Government officials are in regular contact with NHS Blood and Transplant about a range of issues. The NHS in Scotland is already fully devolved, and independence will not change the way in which cross-border transplantation of organs is managed. NHS Blood and Transplant agree with this assessment and has confirmed in writing that it does not believe that there would be any significant change in the management of organ donation and transplantation in the event of Scotland becoming independent.
Christian Allard.
I thank the Minister for his answer as a regular blood donor. Would you agree with me that the No campaign should confirm cross-border organ transplantations will be unaffected by a yes vote?
Minister.
Member, I don't know if I'm best placed to give advice to Project Fear on how they wish to lead their campaign, although I do think trying to raise fears around the idea that in independent Scotland people would have difficulty in accessing organs for transplantation took it to a new low. Yes, the member is correct that NHS Blood and Transplant have made it clear to us that they do not believe that there would be any significant change to the management of organ donation and transplantation in the event of Scotland becoming independent. Organ donation and transplant activity across the UK has always been delivered on a collaborative basis across the UK, and when Scotland becomes independent, this will continue to be the case, a position that was set out very clearly in the Government's White Paper.
Nanette Milne.
Thank you. Like the Cabinet Secretary and I presume the Minister, I'm anxious that health does not become a political football in this place, and I don't like to see that happening. But could I actually ask, is it the case? I know we currently enjoy this reciprocal arrangement because we're part of the United Kingdom, and my family has benefited from that. But in the event that we did become independent, would Scottish patients then have the same access rights to treatment in England as, say, French patients? Would that then put us onto a European waiting list for transplant? And what would the changes be there? I mean, how much would have to be negotiated along those lines?
Minister.
With regards to transplantation, it would be the same as it is at the present time, and in terms of within the European Union, it would be the same in terms of reciprocal health arrangements, as is the case at the present time right across Europe. And as the member says, she's keen not to have this issue turned into a political football. I do recall it was the member actually raised this particular issue with NHS Blood and Transplant about asking for clarification last August on this particular issue, which they've provided. Clear clarification is that it will have create no uncertainty. In fact, the Irish Government have an agreement with NHS Blood and Transplant, and across Europe you have Eurotransplant and you also have Scandi Transplant, where countries work together in the sharing of organs, which is exactly what will happen when Scotland becomes independent.
Question number 12, John Pentland.
To ask the Scottish Government what action it has taken in the last year to assess and address the incidence of plagiocephaly.
Minister Michael Matheson.
The Scottish Government and NHS Scotland have not assessed the instance of plagiocephaly in the past year, but the condition would be monitored as part of the Scottish Child Health Programme in the same way as any other condition. In the case of simple postural plagiocephaly, the majority of cases resolve themselves without the need for any treatment. The Scottish Government provides information to all new parents which recommends supervised tummy time for all babies. For a very small number of babies, physical therapy and repositioning advice will be provided by the NHS.
Thank you. Before I call John Pentland, can I ask members to ensure their phones are off? John Pentland.
Can I thank the Minister for that reply? However, responses that I have obtained from the health boards show gaps in their knowledge and information provision to parents. So isn't it the case that because of Scottish Government's disinterest in inaction, hundreds of severely affected babies every year may be missing out on the treatment they need?
Minister.
Well, the provision of information is provided at the time when the baby is born to those parents, and individual boards are responsible for making sure that that takes place. We make the provision of information available to them, and it's important that boards do that effectively. It's important to keep in mind that very few babies with this condition actually require any form of clinical intervention, with the vast majority of the children in a situation where it resolves itself within the first 5 years. Where there is a requirement for specific clinical intervention, the child would be referred to a community paediatrician and, if necessary, would then be referred on to a paediatric neurosurgeon for the issue to be considered in more detail. But this is a condition where very often it's only a few children that will require that type of clinical intervention as and when necessary, and NHS provide that across the country.
Question number 13, Malcolm Chisholm.
Government how much the NHS has spent on operations and procedures in the private sector in each of the last 3 years.
Cabinet Secretary Alex Neil.
Presiding Officer, while information is not held centrally, specifically in relation to spend on operations and procedures, we have obtained from NHS boards the spend on the use of the private sector to deliver acute hospital waiting times guarantee and standards in each of the last 3 years. This was £8 million, 11.6 and 28.5 million. The increase in the use of the private sector in 2012-13 relates mainly to two boards who are currently experiencing capacity issues, NHS Grampian and NHS Lothian. NHS Lothian is dealing with the challenge that capacity at Edinburgh Royal Infirmary, as the member is aware, is 20% lower than required to meet today's needs. That is why the board has agreed a plan that will see it invest in a multi-million-pound expansion over the next year, which will reduce its requirement for using the private sector. NHS Grampian has recently agreed an £18 million investment programme that will increase capacity by building new theatres and employing more doctors, nurses and support staff. This additional capacity will also significantly reduce their need of the private sector from 2014-15. The Scottish Government policy on the use of the private sector is very clear. We expect boards to build sustainable capacity in the health service, with the private sector only used in the margin.
Malcolm Chisholm.
On the 6th of June last year, the British Medical Journal published a call from NHS Scotland at a national level for expressions of interest from private sector healthcare providers to provide clinical services to the NHS in Scotland. Can the Cabinet Secretary tell us what the response was to that call? And more generally, can he tell us what the role of the Scottish Government is in planning and arranging the provision of private sector clinical services for NHS boards?
Cabinet Secretary.
Primarily, these services are organised by the boards themselves, but they are very often in consultation with themselves. For example, in the case of NHS Lothian and NHS Grampian, very clearly, because of the very substantial investment programmes that are being put in place to meet the quality and patient safety requirements as well as the waiting time guarantee, then clearly these have to be agreed with the Scottish Government before they are implemented and agreed.
Aileen McLeod.
Thank you, Presiding Officer. The Health Secretary may be aware of the increasing number of elective surgeries such as hip or knee replacement that are taking place in the private sector south of the border. Is the Cabinet Secretary aware how waiting times for these surgeries compare in Scotland where they are carried out in the public sector?
Cabinet Secretary.
I am indeed, and the waiting times are far superior in Scotland than they are either in England, Wales or indeed in Northern Ireland, and I would be happy to place in spice more information on the comparison on waiting times on various procedures between the Scottish Health Service and comparable figures for each of the other three administrations in the United Kingdom, and it just shows how we're delivering on the health service in Scotland. We have agreement amongst all the parties in Scotland that we will deliver the health service in the public sector, and we will not privatise it by either the front door or the back door in the way that Andy Burnham set the process alight south of the border.
Question 14, Alison Johnston.
To ask the Scottish Government how it supports community-led healthy behaviour change projects.
I'm sorry, Ms Johnson, could you read that again? I think we couldn't hear you.
Certainly. To ask the Scottish Government how it supports community-led healthy behaviour change projects.
Minister Michael Matheson.
As a government, we have been investing heavily in this particular agenda with the national outcomes for reducing premature mortality and increasing physical activity. We recognise the importance of community participation and ownership. We are committed to a decisive shift to prevention linked to the desire for reform and delivery of public services across Scotland, which is founded on the asset-based approach and the principle of co-production within communities.
Alison Johnson.
Thank you. I thank the Minister for that information. During the budget process, we highlighted the need for a health fund designed to harness the creativity and local knowledge of community groups and organisations. The Climate Challenge Fund uses this model to promote low-carbon projects, and we'd like to see the same community control approach taken with obesity and addressing health inequality. Does the Minister agree that, while we can ask people what action they think public bodies should be taking, putting people and community groups in charge of at least some of the health budget will lead to more innovative and locally relevant activities?
Minister.
There's already some activity in this area taking place in different parts of the country. For example, I visited a project in Fife a number of months ago, which has been supported through Inspire Scotland and the Health Board and other partners, which is very much about providing resource to the local community for them to identify the key issues that they wish to see being addressed within the local community that can help to build on the assets within that local community much more effectively. And that's the type of approach we want to see happening across the country. And the work that we're undertaking with organisations within the third sector, particularly organisations like Inspire Scotland and others, is to look at building on that type of asset-based approach to empower local communities to use the assets that they have that can help their health and well-being, and that's an approach we will continue to take in going forward. Now, I'm aware that the member and our colleagues have had discussions with John Swinney around the budget process in this particular issue, and as the member will be aware, Mr Swinney highlighted the financial limitations in which any new fund would have to operate. But I'm more than happy to engage with the member if she's got specific ideas that she feels that could be scaled up on a national level that could effectively help to drive this agenda forward better than we are at the present time. Then I'm more than happy to have that dialogue with her and to look at the examples of what could be achieved in doing so.
Question number 15, Jim Eadie.
Thank you, Presiding Officer. To ask the Scottish Government how many whole-time equivalent staff are employed by the NHS.
Cabinet Secretary Alex Neil.
Presiding Officer, there are 135,016.3 whole-time equivalent people employed in the NHS in Scotland. This figure excludes general practitioners and general dentists and their staff, and is 7,954.4 whole-time equivalent greater than when this government came to power, an increase of over 6%.
Jim Eadie.
I thank the Cabinet Secretary for that answer. While it is to be welcomed that there are more NHS staff than ever before, can the Cabinet Secretary confirm that the staff who work in the NHS must be able to report and feed back any issues that impact on patient safety in a culture that is free from fear, intimidation or bullying? Can he confirm that the NHS Scotland confidential alert line will continue, and when will the Government publish the findings of the evaluation?
Cabinet Secretary.
Presiding Officer, not only must they be able to report and feedback on any issues, they should absolutely, as a matter of duty, report back on any issues of malpractice or patient safety that they can identify in their working environment, and they should be able to do so without any fear or favour. I am considering carefully whether to extend the NHS Scotland National Confidential Alert Line beyond the pilot phase, and I hope to be able to make an announcement on that soon, although I'm sure the member will have noticed that I announced a few days ago that there will be no more confidentiality clauses where there are severance agreements between the National Health Service and its employees, a measure I'm sure that is welcome throughout the chamber.
Very briefly, Ken McIntosh, question 16.
Thank you, President Officer. To ask the Scottish Government whether there is a difference in mortality and readmission rates in hospitals at the weekend compared to weekdays.
Cabinet Secretary.
Presiding Officer, a recent study of the mortality data provided by NHS boards to Information Services Division of NHS National Services for Scotland in response to a Freedom of Information request suggested that there is no evidence that there are significant differences in the mortality rates in hospital at the weekend to weekdays in Scotland.
Ken McIntosh, briefly, please.
Can I thank the Minister for his reply, although I'm both surprised and disappointed that he's not aware of the number of studies carried out over many years in many countries revealing worryingly high death rates in hospitals at weekends. Is the Minister aware of a specific case I've written to him about, a very upsetting case indeed, where a patient, a constituent dying of cancer, was admitted over the weekend and was the subject to very poor levels of care and treatment, despite making his own palliative care wishes well known in advance? Does the Minister agree with me that if we are to prevent such upsetting cases happening again, we'll need to see a substantial increase in staffing levels in our NHS in the hospitals at weekends and public holidays?
Cabinet Secretary.
First of all, Presiding Officer, can I say that obviously our sympathies would be with anyone in the situation in which Ken McIntosh's constituent and the family found themselves. But the fact that that happened at the weekend, we cannot generalise from a particular case that there is a systemic problem at weekends with mortality rates in Scottish hospitals because of what happened in one particular case. Can I also say that I am very familiar with the international figures, but I'm also familiar with the fact that the Scottish Health Service is the safest in the world through the Patient Safety Programme, and that is probably a major contributing factor as to why we do not have a higher mortality rate at weekends than we do during the week. And perhaps we should emphasise the safety of patients in the health service in Scotland instead of trying to scaremonger because of what happened in one case.
That concludes portfolio questions. We move to the next item of business, which is a debate